My name is Catherine. I live in Central Florida with my husband of almost 30 years and my 2 dachshunds. I've been on TYVASO DPI since February of 2023. Prior to that, I was on TYVASO via the nebulizer. I saw that United Therapeutics had come out with a version of TYVASO that you could take with just using the little device. I asked my cardiologist if I could switch from the TYVASO, the nebulizer version, to the TYVASO DPI, and he agreed. Your dosage of TYVASO DPI will vary depending on the number of breaths that you're currently taking with a nebulizer. In order to equal the 15 breaths I was taking from the nebulizer, my doctor did the calculations. They found out that that equals 148 microgram cartridge and 132 microgram cartridge. I find it quick and easy to take each dose as prescribed every 4 hours. I have not experienced any side effects with TYVASO DPI other than just coughing right after I do my treatment. And I had the same side effect when I was taking the nebulizer too. I have medication prescribed by my pulmonologist to manage any extensive coughing. Everybody's experience is going to be different. If you experience anything unusual, please bring it to the attention of your doctor immediately. My doctor's office has 3 floors, and I was using the elevator for the longest time, but now I'm finding that I'm not having the trouble climbing the stairs. I don't need to stop at each landing at each floor. TYVASO DPI increased my energy, and I'm able to participate in more family activities. You're more free to take it with you, take it on the go. If you're considering TYVASO DPI, I would highly recommend discussing with your physician. It's helped me, and I would highly recommend it.
What are TYVASO and TYVASO DPI? TYVASO, treprostinil inhalation solution, and TYVASO DPI, treprostinil inhalation powder, are prescription medicines used in adults to treat pulmonary hypertension associated with interstitial lung disease, PH-ILD, WHO Group 3, which is high blood pressure in the lungs due to inflammation and sometimes scarring in the lungs. TYVASO or TYVASO DPI can improve the ability to exercise. Important safety information. Before you take TYVASO or TYVASO DPI, tell your healthcare provider about all of your medical conditions, including if you have or had previous bleeding problems, have low blood pressure, or if you have asthma or chronic obstructive pulmonary disease, COPD. If you are pregnant, plan to become pregnant, or are breastfeeding, tell your doctor. It is not known if either product will harm your unborn baby or pass into your breast milk. Tell your healthcare provider about all of the medicines you take, as either product and other medicines may affect each other, especially medicines used to treat high blood pressure or heart disease, or that decrease blood clotting, anticoagulants, water pills, diuretics, gemfibrozil, Lopid, or rifampin, Rimactane, Rifidin, Rifamate, Rifitor. Both products can cause serious side effects, including low blood pressure, symptomatic hypotension, and bleeding problems, especially in people who take blood thinners, anticoagulants. The most common side effects of both products are cough, headache, throat irritation and pain, nausea, reddening of the face and neck, flushing, fainting or loss of consciousness, dizziness, diarrhea, and shortness of breath. Like other inhaled prostaglandins, you may have trouble breathing after taking TYVASO or TYVASO DPI because it may cause the muscles around your airway to tighten, bronchospasm. These are not all the possible side effects. Call your doctor for medical advice about side effects or if you have trouble breathing. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about TYVASO or TYVASO DPI, talk with your healthcare provider. Please see full prescribing information for TYVASO or TYVASO DPI, instructions for use manuals for TD100 and TD300 TYVASO inhalation system, and TYVASO DPI inhalation powder, and additional information at www.tyvaso.com or call 1-877-UNITHER, 1-877-864-8437.